So thank you everybody for joining us this afternoon for this healthcare webinar called What's Next for the Healthcare Administration Leadership Post-Pandemic. My name is Amanda. I'll be moderating the session for us today. So thank you for joining us and spending some time with us this afternoon. We've got a lot of content to go through and a lot of great questions and great topics to cover. So we're just going to get right in and get started. Just a couple of housekeeping things for those of you that are on the phone and have joined us today. You are all muted currently, just so we can keep the background noise down. But please do feel free as we go through this webinar to submit questions through our chat feature. I will be moderating this on the side and as appropriate, sort of working those questions into our flow, but also we'll have time dedicated at the end to answer any questions that are outstanding. Additionally, if we run out of time because we do love this topic and everybody has a lot to say and share, we will make sure to get those questions answered and connect to you all with the appropriate resource. So we just make sure that you get your questions answered. So with that, I'd like to turn it over to our speakers today to introduce themselves and tell us a little bit about their roles and responsibilities at their respective positions and their sort of relevant past either industry or academic experience that brings them here today. So Michael, why don't you kick us off?
Great. Thank you, Amanda. And thank you to everyone who has joined us today. Really appreciate the time. And I think it will be an enlightening and interesting conversation that we have. Before I start with my introduction, I just would like to take this moment to thank all of the essential workers, all of you healthcare workers who have been out there in the front lines for the past year plus, really doing your jobs day in, day out in extraordinary circumstances, taking risks, trying to avoid risks. And just keeping us on track through this really once in a generation pandemic. And so I just want to take a minute to really thank you all very much for your hard work. I see this represented in our students all the time, and in many ways. And so thank you very much for your hard work and dedication. So my background before coming to Champlain, I've been at Champlain for about 11 years as the director of the undergrad and graduate healthcare administration degree programs. Before that, I was the chief operating officer of a hospital for quite some time. And really, so my background in administration, healthcare administration, goes way back. Before that, I was the director of organizational and staff development for a hospital. I had been a paramedic for many years, flying on a life flight helicopter. I taught paramedics. I was a member of the regional faculty for New York State's Emergency Medical Services Program. And before that, I was a research assistant at an immunology research lab. My undergraduate degree is in chemistry, and my graduate degree is in human resource management and healthcare administration as specializations in an MBA. So, golly, for the last 45 years or so, I've been involved in healthcare in one manner or another. And then about 11 years ago, decided that I loved teaching. I loved healthcare administration. I love seeing what students are able to do with newfound knowledge. And so I started at Champlain 11 years ago, directing this program, and continue doing that now. So that's a bit about me.
Thanks, Michael. Priscilla, I see you next on my screen.
Good afternoon, everyone. I'm Priscilla Latkin. I'm the director of the Training and Education Department at Rutland Regional Medical Center down south in Rutland, Vermont. We are the largest community hospital in the state and the second largest hospital in the state. UVM holds that distinguished position. And we serve not just the southern part of Vermont, but also areas of New York, New Hampshire, and Massachusetts. We have a very highly regarded orthopedic clinic here. And so we do get folks from all over the country that come here for their joint replacement. We are a 144 bed licensed hospital here, so we're not a large hospital. However, we do serve our community in many, many specialty areas beyond just hospital care. So for me, professionally, I graduated from the University of Vermont back in 1985 with a Bachelor of Arts in Political Science and History. And at that time, my goal was to pursue law. I changed my mind along the way. And 11 years ago, I found myself working in healthcare here at Rutland Regional. It was not part of my original plan. And at that time, I joined the hospital as their communication specialist, managing both the internal and external being the public relations for the hospital. And about 3 years into that role, I was given the opportunity to run the training and education department. And so what that means is I have 6 clinical educators that report to me. I have training specialists that report to me. And we also oversee the EMR, or electronic medical record training needs for the organization as well. And so the clinical educators on my team, they all have at least an MSN or Master's in Nursing degree. I have 1 PhD, I have 1 doctor in my department. And they have specialty areas: inpatient, outpatient, OR, and also the emergency department. So they're very well versed with respect to all kinds of patient care. And the training specialists in my group, they actually help create, deliver, and facilitate all different types of learning events, including online modules. A couple of years ago, I was still in a management role here in the hospital, and my leaders, the vice president of HR and the CNO, said to me, "I think it's time you go back to school and get your master's degree so we can elevate you up to a director level, which means more responsibility and also participating in a different level of leadership decision-making," which was very appealing to me. So I entered the Champlain College master's degree in healthcare administration, one of the best decisions I ever made. I was reluctant at first about online learning, being an old school in-person education experience, and found it to be extremely rewarding, very informative, and I learned much more from the other participants than I probably did from the actual lessons. But I think 3 of my professors are present today, and so I thank them for all that they brought to the table as well. And so for those of you participating in the undergraduate or graduate degree, I applaud you. You're going to get a lot out of it, and you'll learn hopefully today a little bit about how I brought that education to my job, especially over the last year. So thank you, Amanda, for the opportunity to participate, and thanks to all of you for participating today.
Thanks, Priscilla. Dawn, let's kick it over to you.
Okay, my name's Don Lewis. I've been at it for a long time, probably 40 plus years as well. I was a hospital CEO for 25 years. I've done a lot of work with advocacy and representation, fundraising and development, pretty much every aspect of running a small rural hospital, because my background was focused on rural healthcare. Is something I've been involved in and developed an expertise in. I teach the 2 introductory courses to the MHA program at Champlain, and find it to be very exciting and interesting. We'll talk a little bit more about the classes in a bit, but the format, even though it covers traditional structural makeup of a hospital and a healthcare system, it's all done through the lens of systems thinking and learning. And so it adds a dimension to it that you're not going to find in other degree programs. I also have the benefit of being a licensed nursing home administrator in New York State. I'm also certified as a telehealth coordinator. I'm a big proponent of telemedicine, and the pandemic has ushered telemedicine to the forefront like never before, which is really nice to see. So it's really great to be here and look forward to answering any of your questions.
Thanks, Don. And Neil, why don't you wrap us up?
As lawyers always do, I'm an attorney, which makes me, for better or worse, unique in the group today. Most of my career has been in employment law, but as it morphed into a variety of things. I actually was the in-house benefits counsel for a corporation, which gave me experience, started giving me experience into healthcare. Then when I was representing employers on my own, I represented a number of medical organizations and helped them. I'm also a mediator and arbitrator, and I've actually done arbitrations involving the termination of an employee in a major hospital in Connecticut. And better yet, for my qualifications for teaching healthcare law, which I've done with Champlain over the last couple of years, I have been married for 39 years as of Friday to a pediatrician.
Oh.
And that actually has given me, thank you.
Yeah.
I think she deserves it more than me. It really has very honestly given me an insight, being married to her and small pediatric practice, an insight into the medical field that people who are lawyers would not otherwise have. So I've really enjoyed teaching healthcare law. Priscilla, did I have you as a student? I don't remember, but I may have. But anyway, employment healthcare law is a required course in the healthcare administration. And one of the more exciting things about it, very sincerely, is every day you open the newspaper and there's something else that directly relates to my course, whether it's electronic medical records, HIPAA, Medicare, Medicaid, Affordable Care Act, and unfortunately COVID. They're all related to what I teach.
Thank you, Neil. Thank you all for your introductions. I appreciate it. So question one for this panel, what did the pandemic do to the day-to-day responsibilities of healthcare administrators and leaders? You know, how did those responsibilities change? And do you think they, shone a light on the industry in any particular way, good or bad?
Well, let me, thanks, Amanda. Let me start off with a few ideas, and I'm sure the other panelists will chime in when needed and when they have their own ideas. But, when you think about healthcare administration, it really covers a wide range of environments. In other words, it's not just about hospitals. I mean, there are private practices, there are freestanding labs, freestanding radiology clinics, medical equipment manufacturers, insurance companies, pharmaceutical companies. You can just go on and on about the environments in which healthcare is provided or has some connection to. And so I want to make sure that when we are talking about some of these questions, hospitals obviously are the largest of these organizations, and so they kind of come to mind first. But our students actually come from all of those different organizations that I just mentioned, and more. Government, policymakers, make up a large portion of our students as well. So the context is broad. The day-to-day responsibilities really were upended by this pandemic across all administrators. In other words, regardless of the particular focus and topic, the focused responsibilities that any particular administrator might have, the response and the reaction of the healthcare system to the pandemic has necessitated changes in logistics and staffing and public relations, managing communications. In a hospital, just the way procedures are scheduled and carried out and canceled and reprioritized. All of these things required each manager to look at their own area of responsibility and think differently about tomorrow is a different way to do things. So let me just stop there and see what everybody else has to say.
Yeah, I'll just add to that. Healthcare in and of itself is complex, and the complexity has existed prior to the pandemic, and it's going to continue after the pandemic. But the point is that what Michael said is so right on. The pandemic has sort of stood everything on its head. So you had the complexity of healthcare before the pandemic started, then came along COVID-19. And all of a sudden, a whole level of complexity was added to the whole dimension of managing healthcare organizations of whatever type they are that didn't exist before. So in a way, it's almost like, you know, people were dealing with, and still are in a lot of regards, dealing with it's a crisis every single day. How do you deal with, you know, staffing issues? How do you deal with supply chain issues? One of the things that, you know, that's been a quote unquote a negative, but from a positive perspective, has to do with the fact that we've discovered problems in the supply chain at the federal level, the state level, local level. So then the question becomes, how do you address those going forward? What are the opportunities to make a difference going forward, so that if the next pandemic happens tomorrow or the next crisis, how do we not repeat the errors of today or of the past, if you will? And so we are seeing turnover in senior leadership positions. And so that actually bodes well for people coming into healthcare administration in whatever form, because there are vacancies that are occurring every single day. Staffing across the board has been affected in a lot of ways. And so the challenges that were there are still there, compounded somewhat. So you have to learn how to think on your feet, be good with, be flexible, and actually learn how to be comfortable in the face of chaos, because a lot of times chaos ensues. And when it does, you have to be grounded and solid so that, you know, you as a leader set the example, because the example you set makes all the difference in the world.
So from just a quick legal perspective, not only was it a crisis every day and everything was turned on its head, but some of the laws just did not apply, and some of the laws and regulations kept changing. I mean, an example was public health officials were trying to get numbers as to whether people have been affected, hospital counts, and then the hospitals would turn around and say, oh, but we're not allowed to provide personal information because of HIPAA. So you really had to scramble in all sorts of ways.
So what I'd like to add is, because I lived it, I'm still living it. So I think what's important to keep in mind that pulls together everything that the other panelists have shared is the incident command piece. It's important to understand that leaders of all different levels had to come together very quickly and very quickly identify what you could contribute to the cause. And it wasn't just the facility. So as a hospital, it wasn't just us, it was our community too. How do we keep our community informed? How do we help them understand what we're doing, not just for them as members of our community, but for the primary care physicians in our community, the dental offices in our community? So for example, let's take PPE. Everybody in the country now knows what PPE is. How many people in this country knew what PPE was a year and a half ago? Now everybody knows it, everybody uses it, right? And so understanding that all of a sudden we had all these people that were in our community that somehow took care of patients or had a role in our community where they were engaging with other people, and they had to have the proper PPE, gloves, mask, face shield, eye protection, whatever it took. And we, for our community, and I'm sure a lot of other healthcare facilities, became the resource to do the training, the education, possibly provide that equipment to all the people that needed it, and to help them understand why it was so important. And then you had to enforce it, because you had people that didn't want to, even people that worked in healthcare that didn't feel they needed to. And so going back to policy, creating policies, understanding what you could mandate within your facilities around these things, it was very important to understand how you could do that legally and how you could do that effectively. And I can only speak from my experience, but for the first 6 weeks, Incident Command met every single day, 7 days a week, sometimes 3 times a day, because this pandemic had a lot of uncertainties to it. It was a highly contagious virus. At first, everybody thought it was contact driven and airborne driven, and nobody really knew. So the learning that had to happen on a daily basis on what you needed to do each single day to really help people move forward and do what they needed to do to take care of patients, to go to work, to take care of their community. Online learning became a big thing. People working from home, that's huge now. Think about that impact to the healthcare industry and other industries in our country. Zoom, oh my gosh, if you had stock in Zoom a year and a half ago, how lucky are you, right? Same thing with Microsoft Office and Teams. So I think there's so many different things that have impacted us as a society and certainly as healthcare. And I know that through the degree programs, you learn about incident command and you learn about the importance of project management and all of those elements. And so for me personally, I brought that right to the table right away on day one. And we still have incident command meetings weekly now. We're down to once a week, which is refreshing for us who are doing it every single day. And so that's what I really wanted to make sure I shared with all of our participants today, is understanding the importance of coming together as a team, knowing everybody's expertise, and how do you leverage that and make sure that it's contributed at a level that's effective and efficient for the common cause. So thank you.
I want to add one other thing to this. It gets talked about a lot with regard to the notion that people are the most important asset to an organization, and they absolutely are. And so you go back historically, being respectful, being supportive, acknowledging people, so they know that their efforts and what they contribute is appreciated, has always been important. With the pandemic, it's doubly so, because people are being asked to do more with less. There's a lot more stress in a lot of regards. Burnout could be particularly higher. So from a leadership perspective, it really is important for leaders to acknowledge staff, for staff to know that they're supported, and for staff to understand that we're all in this together. And it isn't just the frontline or the frontline workers, if you will. It's everybody together, and that message has to be communicated so that even in today's age, sort of the notion of us versus them kind of exists in a lot of places. Well, it really is everybody's in the same boat, irrespective of the level you're at within an organization. We're all in the same boat, and everybody has to be moving things in the direction that is for the benefit of the community, the patients, and the organization.
Yes,
Yeah, that's
absolutely.
Yeah, great points, everyone. And I just want to add one thing. When you're thinking about healthcare management and leadership, and we address this a lot in both the undergrad and grad degree programs, you have to think of things in an interdisciplinary way, because every decision has many facets, many parts to it, that one part will affect another part, and on and on. One of the things you have to remember during this pandemic is that all the while this is happening, all the while we were being turned upside down and thinking about, logistics and staffing and, supply chain and all the things that have been in the news for the last year and a half, people's healthcare needs, routine healthcare needs, did not stop. People still had fractured ankles and still had, MIs, and still, required, got colds and all kinds of things, So all the while this was going on, the normal healthcare needs of the population still existed at the same and then increasingly more levels, layered on top of or underneath the pandemic. And so all of that had to be on the minds of leadership and management.
Thank you all. So, so Don, you touched on this a little bit in one of your answers, so I want to sort of pivot us this way, but you talked a little bit about staffing and just people power, right? And just having people to fill these roles and to provide all these services. So I want to talk about that a little bit in the job market, and how does the pandemic continuing to affect this job market, the outlook for folks that are in this program now or that are either maybe considering it? What's the takeaway for them?
Well, from my perspective, going back to something that was already mentioned, if anybody hasn't subscribed to Becker CEO reports, subscribe to it, because it's an online daily newsletter about what's going on in the healthcare world. You get those, and every single day of the week you're seeing CEOs, COOs, VPs of this, VPs of that, either retiring, resigning, leaving jobs. I mean, so the turnover rate is substantial. I don't know what it is today in across the board in leadership positions, but it is substantial. And I say that, well, and actually it's just what it is. There's always been a turnover rate. But for people coming into healthcare and people looking at the MHA program or the undergraduate degree program, there's just tremendous opportunity for job growth and development, because there's going to be a lot of vacancies. Not only that, you have folks like myself, who have lost all their hair, not quite, but almost. And so, someday I'm going to sail off into the sunset. And so when I do, somebody else is going to need to pick up the ball. And so you have a lot of people in healthcare leadership positions that are just naturally matriculating out because of they've been doing their jobs for 30, 40 years or whatever the case may be. And it's time for them to enter a new phase of life. And so all of that just portends great things for people coming into it. The other thing that I would say is, he says, as difficult as everything seems to be, and as hard as the pandemic has been, the challenges are opportunities. So people coming into this, when you look at creativity and innovation, and it's something we talk about a lot in the program, we need as much creativity and much innovation in healthcare today, maybe more so than we ever have. And so people coming in have the opportunity, if you will, to sort of leave their mark. There's no right or wrong answer to what the future of our healthcare delivery system is going to look like. It's going to be what we make it. And so everybody has the opportunity to really contribute, whether it's at a local level, a state level, or a national level. And whether you're focusing on health policy or the running of an FQHC, or you're working a dental practice, it doesn't matter. I mean, you really do have the opportunity to make a huge difference in the overall structure and delivery of healthcare in this country.
So Don, I wanted to add to that also. It's not just people who are leaving the field. Everyone's kind of forgotten in terms of medical issues over the last year because of COVID, that the United States is an aging population. Mm-hmm. And in the context of an aging population, there's going to be more and more demand, forget COVID and pandemics, more and more demand for medical skills. And I hate to call them nursing homes, assisted living facilities, nursing homes, caregivers, all of that is going to expand as the population ages. We also have, with the pandemic, hopefully it will be funded adequately, but people are already talking about, God forbid, the next pandemic. So that this is really a great boon in terms of hiring for pharmaceuticals, for research and development, for scientists. And don't forget, especially with electronic medical records and telemedicine and AI, you're really going to need computer people and managers of those computer people. So medical field's really spanning out.
I think there's also been opportunities created in finance. And I bring that up because of the reimbursement process that's in place now. If you have expenses that have been incurred due to the pandemic, There's a process in place for both state and federal funds that are being available to help offset some of those costs. Also costs that were incurred in the interim before you could reopen up elective procedures and other healthcare services that had to be either put on hold or delayed due to the pandemic. And so there have been several different types of positions created in the finance world, also with respect to understanding how to manage supply chain, distribution, purchasing. Fortunately, as an organization, we never cut back on what we were ordering for inventory with respect to PPE and other necessities. And so we never felt that, we never felt like we were undersupplied, or we never were desperate at any given time, which was great. And we were actually able to help other healthcare organizations. And so I think just having people in place that can have some big picture thinking and also some future sight on just being prepared for that next thing. And I will share with you, we had a bit of a moment because we had heard from a hospital in Boston about 3 months ago that they had an Ebola case. And we thought, oh my goodness, could we have to deal with COVID and Ebola all in the same, And so things like that can happen. And so I think there are other opportunities available now in healthcare that require people with that thought process and how to better manage the planning part and the financial part.
Yeah, those are great points. And it just illustrates, again, the interdisciplinary nature of healthcare. You need leaders and managers who are experts in finance, in communication, in supply chain, IT, quality outcomes, all of those things. Actually, if you look at our courses in the programs, those are the titles of our courses. We approach this in such an interdisciplinary way because that's the way healthcare is. And as I said, decisions in one area affect all the other areas. I'll just close on this note that I just saw a statistic a couple of days ago saying that about 20% of the top senior leadership will be retiring in the next 3 to 5 years. So as senior leadership retires, some due to the pandemic and some due to just natural aging, this opens up great opportunities, I think, in the job market for everybody who is well prepared to be a leader and a manager in healthcare.
I want to add to what Michael just said. One of the things from my perspective that makes the Champlain program really unique, and I speak from experience, is the fact that it isn't just theoretical. It's what's the practical application of the material. Okay, I mean, theory, you need to understand the theory of something, but then what's the practical application of it? And especially in the online learning platform, knowing that what you're learning is applicable to what you do day to day. And a lot of times what the applicability isn't just limited to what you do professionally. It can translate into one's personal life as well. And so being able to, because most of us, from what I understand, have been involved in healthcare, we aren't just talking about something theoretically, we're talking about what's really happened out there. We've lived this, we've done it, we've experienced it. And being able to bring that aspect of awareness to the classroom, I think makes a tremendous difference.
Great, thank you. So I'm curious, as a quick follow-up to this, as we're talking about the changes to the job market and this top 20% of leadership retiring, and this interdisciplinary nature of the positions, right? Do you all see this this as a trend? You know, is this a bubble that's going to pop and then in 10 years from now, these positions are going to go away? Or do you see this as a continuing need, like people that are coming into these roles and this field need to continue to think in that multifaceted nature?
I say it's a continuation.
Mhm.
Yeah, and I'd say it's an expansion, just like I said, you know, the industry, gosh, I don't know, maybe Michael knows what percentage of employees in the country are in the medical, some way connected with the medical field, but it's just growing.
It
Lawyers
is.
too, dealing with it too.
Yeah, I don't have a number. I don't know the exact number, but it's significant. It really is. If you look at the, you know, gross domestic product and the portion of that healthcare has, you know, in some way is connected to, there are a lot of employees. And yeah, so, you know, Amanda, I think it's really a function not only of this once in a generation pandemic, and as Priscilla mentioned, there could, you know, the next one could be coming, is coming eventually for sure, but also the demographic changes in the country. You know, as the population is aging, we've seen demands for healthcare and healthcare employees, you know, increasing year to year to year, and that's certainly not going to go away, and it's probably, as Neil said, going to keep expanding.
Great, thank you. So if we think about these, you know, you all said the words interdisciplinary, and Don said comfort in chaos, which really sort of resonated with me, and this showing appreciation for staff and who you're working with, and how do you, it all sort of brings me down to this point of, how do you learn this? I mean, how do you all implement this in our program, our healthcare administration program? So you prepare these students and these people that are in these roles to be that comfort in chaos and be able to navigate this. You know, what do you do there?
Well,
You know, let me start off and say that, you know, so both of our undergraduate, graduate, and grad programs cover all the fundamental aspects of management and leadership that you would expect. You know, we have healthcare law and IT and HR and quality and communications, you know, project management, all the nuts and bolts that you would expect in a business management program. But we do this from the context of healthcare. You know, all these courses were developed with industry experts, many of whom are on this panel. We looked at, you know, what is it that people really need to do when they're a leader and a manager in a healthcare setting. And so we convened experts in the field and designed these courses squarely focused on the idiosyncrasies of the healthcare environment. You know, what other industry, speaking of finance, for example, you know, hospitals are regulated regarding what they can charge for a procedure, either through Medicare or insurance companies. There's a regulation that says they can charge X amount of dollars for a procedure, but their expenses are completely unregulated. Vendors can charge whatever the market rate is for that hip replacement, but the hospital has to charge only what they're allowed to charge. So what other businesses like that? None. You know, why would you go into a business like that? Good question. But you know, this is why it's important to realize that our healthcare degree programs are squarely focused on the particulars of healthcare. You can apply our nuts and bolts concepts to any industry, probably more easily in many cases, because they're, you know, other industries are more generic. But learning what we do in our very squarely focused degree programs, we try to instill in students, how do you apply this knowledge in real life? How do you take this, use it in your day-to-day work environment? And that's how we really try to mimic in our courses reality of what healthcare leaders really need to be able to do. And so I'll stop there and let the other panelists chime in.
So I will add, based on my experience in the program, I had opportunities in all of the courses to integrate and be really thoughtful about how the core values of my organization, our culture, our vision, our mission, how those things really impact who you are as a professional and what you bring to your organization every day and what you bring to your community and potentially also into your personal life as well. And so I found, for me personally, when you go back to rewards and recognition, plus the concept of working as part of a team or the interdisciplinary concept, you really need to integrate what your organization represents culturally and understand that to be successful in your organization. And so I found there were a lot of opportunities, whether I was on the discussion board or writing a paper or doing a project, where I would integrate those elements of my organization that really do impact my success as a healthcare professional. So that's how I would answer that question, Amanda. That's what I would contribute to that.
Yeah, and I would, Neil, you want to go ahead?
No, you go ahead.
So yeah, I would add to that. So what a key leadership attribute is self-awareness. The more self-aware we become, the better we are at leadership, better we are at navigating life in general. So one of the unique things about the beginning of the MHA program has to do with the fact that we do look at things from, we look at the healthcare system in the context that Michael said. It's all the parts and components. But we look at it through a lens called systems thinking. That systems thinking means that you're going to look at something called personal mastery, which is really about becoming more self-aware. You're going to look at it, as Priscilla just said, through team learning. What does it mean to be a part of a team? How do you build alignment within a team? And how does a team achieve the results that they need to achieve? You're going to look at this thing through the lens of creating vision statements, whether it's an organizational shared vision or whether it's a personal vision, and how do those align? Because when there's a disconnect between a person's values and their personal vision and an organization's values and vision, it doesn't mix. And again, Priscilla, hit upon that. And so we look at all of those we look at the dynamics of healthcare through that lens. And by doing that, it adds a dimension to what you're able to understand and grasp that goes beyond the normal boundaries of just talking about the nuts and bolts of, this is an operational department and that's an operational department. So from my point of view, it's like, how do we work with people so they can look at the macro picture and the micro picture at the same time? How do you understand the overall system dynamics of the fact that everything's interrelated and interconnected, okay, in a system? It isn't just piecemeal, it's looking at it as a whole. And then also, how do you then blend that with the reality of the micro perspective, the day-to-day operational piece? So when you begin to have an awareness that allows you to see the big picture and the small picture relatively simultaneously, it gives you a much greater ability to be successful in dealing with the day-to-day issues or strategic planning or physician relations, community relations, you name it. And so that's in part how I approach getting people from where they start in the program to the point when they're completing the program and doing a capstone project, how it all fits together.
So one of the things I want to add in that is the value to the program goes beyond all of that teaching, which is great, but also the fact that there are students from all over the country in the program. And so most people, me included, get very insular to their teaching or what they do or the right way or the wrong way. And I'll have in a class, a radiologist, I'll have an office manager from Michigan, a radiologist from New York, a facilities manager in California. I have this term, and all of those people share their ideas, not only from a geographic basis, but from an appreciation of their different skills. And in the discussion boards, that'll go back and forth, and they'll say, oh, you really do that in California? Or, you know, the way medicine works in California is somewhat different than the way medicine works in Vermont. So all of that combined enhances a person's experience as they go into their day-to-day work and as they go into their future leadership positions.
Great, thank you. So we have about 15 minutes left, and I think we've covered a lot of ground in this 45 minutes. So I want to give our attendees an opportunity to answer any questions that they might have. So for all those of you that are listening on the phone, if you have a question or you want to pose anything to our panelists, if you use the raise your hand function in the bottom of your Zoom window, I will see it on this end and I can unmute you and you can ask your question. So if anybody is interested in that, to now is your opportunity. All right, Kamal, I see you, so I'm gonna unmute you. You should get a little notification. Yep, you are all set, Kamal.
Okay, perfect. I actually typed in my question in the chats section here, but I'll say it as well. Can you hear me okay?
Yes, we can hear you
Yes.
loud and clear.
Perfect. So my question is really about the after COVID crisis, and what do you foresee as important strategic innovation changes to overcome the financial implications of the after COVID crisis?
Great, that's a great question. Thank you, Kamel, for that. I'll start off. You know, I think this pandemic has illustrated a couple, many different aspects of healthcare, many good and many not so good. In other words, there has been a tremendously successful effort to wrap our heads around this pandemic and get it under control and treat the people we need to treat. And unfortunately, many have passed away, but we really, as I said right at the very beginning, our frontline healthcare workers have done an enormous, heavy lift to get us to where we are now. So that's very good. On the other hand, this has also illustrated some of the weaknesses in the system that we've spoken of. The supply chain and the PPE issues, and public health awareness in general. Public health in the United States has been underfunded and not really well represented up until this point, and really has come into its own much more. Many more people are aware of what the role of public health is. So going forward, I think we need to learn what worked really well and learn what didn't work so well, and our leaders need to really address those things both with innovative and new approaches where necessary. In our programs, we really emphasize that everybody in the programs, for the most part, have some relationship to healthcare. They're either working in it, they have a connection to a healthcare environment. So that adds a lot of depth to our discussions in our course environment, the learning environment, for sure. But that diversity is really important because it provides us an opportunity to look at things differently. And as Don mentioned, the systems thinking approach. What works, let's keep what works. Let's retain the things that work the best. And for those things that need improvement, let's really look at things differently. It's not just the providers who are in the decision making. It is the patients and the families and the regulators, and we need to look at all those perspectives moving forward to fix the things that need fixing and retain the things that work well.
Yeah, I would just add to that the following. Nobody has all the answers. No one person knows everything. What we need to do post-pandemic, some of it's obvious, some of it isn't so obvious, but it's through the collective wisdom and interaction of teams of people working together in classes and in leadership positions to figure out what do we need to do next. There's no cookie cutter answer to everything. It just doesn't exist. What's most important is for all of us to have the ability to think strategically and analytically and be able to have a discourse about what do we need to do for the future to make everything work. You know, a guy by the name of Russell Akoff wrote material on idealized design, and his approach to things is creating tomorrow's future today. So when you get there, it's no big surprise. It's not about planning for the future, which is very different than creating the future today. And so it really requires sort of in a way, sort of stepping back and sort of stepping outside of maybe our comfort zones and being able to listen to diverse perspectives, not just from other people with inside the four walls of our organization, but as Michael was talking about, and Priscilla and Neil have mentioned, it's the community, it's other stakeholders, it's vendors, it's, you know, it's regulators, it's everybody. So we've got to come together in a fashion that allows for all voices to be heard. And there's a lot to be learned from other places in the world. We don't have the market on innovation and creativity in the United States. There are other countries that are doing wonderful things in the healthcare world. And so we can look outside our own four walls to see what works elsewhere. And can we adopt it? Can we tweak it? Can we make it, you know, something that works for us?
Thanks, Don. Thanks, Michael. And thanks for your question, Kamal, too. Let's see. I saw one flicker while I was over here. Rhonda McClellan, I think I saw you flicker, but I don't see it. I don't see your little virtual hand up. So I don't know if your question was answered or if you changed your mind. But are there any other questions from our audience today? Give them a minute to virtually raise. Patrick Rooney. All right. All right, Patrick, I think you should be able to let's see. Oh, nope.
Can you hear me?
Yes.
Great. I wanted to thank everyone for this panel today. This just popped up on my LinkedIn yesterday, and I was intrigued by it. I'm not a prospective student. I am a two-time graduate of Champlain College. And I hold kind of a unique position here because I'm a former CFO of a home health agency, but I currently work as the Director of Health Systems Finance for Vermont's regulator, the Green Mountain Care Board. And I just wanted to support a lot of what's been said today for the folks who are entertaining this program. COVID has created a very pronounced set of issues that were tackled throughout and are going to have to be addressed as we move forward. And one of those that we've experienced here in Vermont with the shutdown last March and April of all elective non-emergent procedures. So hospitals like Rutland Regional, where Ms. Latkin is from, who have that orthopedics program, really suffered a bit of a financial pinch because of that activity. So it exposed some of the fissures that existed in the current payment system around fee-for-service. And one of the creative situations we're going to find ourselves in this state and as our country is how do we pay healthcare? As it's been pointed out, the country is aging, our state is aging a little more rapidly. And as a nation, we have about 10,000 baby boomers retiring a day over the age of 65. So we really have ahead of us in the next 20 years an opportunity to refine the way we pay for healthcare and provide healthcare. And mixed into all of that are these other complex challenges around inflationary pressures of pharmaceuticals and supplies, and also labor shortage issues around nurses and physicians that we're going to have to address as well. So the future is on this panel, or is entertaining this panel right now in the audience. And I sincerely hope we have folks who are interested in tackling those challenges of our generation and moving forward. So thank you for the opportunity today.
You're welcome. Just to add to that, to Patrick's question and comments, so I happen to be president of the Southern Vermont AHAC board here in Vermont, and AHAC works very hard on helping the recruitment process for primary care physicians and other healthcare workers. And organizations like that across the country are really important to healthcare because they recognize that there is a need, and they also recognize that there is an approach to getting people interested in healthcare, keeping them interested in healthcare, and helping them be successful in healthcare. And the cost of education for physicians and for nursing can be a challenge for many. And so working very closely with state and federal agencies on loan forgiveness and other opportunities to help offset just the cost of getting those degrees, I think is a step in the right direction. And, also the fact that there's a lot of medical professionals that work as travelers or local tenants. And so they don't have just one place they're committed to. And that is another area of healthcare employment or healthcare workforce that we need to look at differently and figure out how we can make using those professionals more efficiently for our organizations, because it's becoming more and more difficult to recruit permanent placement when you have people that are more interested in traveling around and picking and choosing where they're working. And so that younger generation of healthcare workers that are coming up, they tend to be very attracted to that type of healthcare opportunity, and less so to a more permanent healthcare location. So that's one of the challenges that we're addressing today and hoping to do a better job of as far as recruitment's concerned. So thank you.
Thanks, Priscilla. And thank you, Patrick, for your comments too. I'm glad to hear we have 2-time grads on the phone. So clearly something happened, right? So we'll take that. That's great. So let's see. We have about, I'm going to call it 2 minutes left before I do my wrap up spiel. So is there any last quick questions from our audience or any last comments that anybody on our panel would like to make? Oh, Kamal's back. 1 second, Kamal, let me unmute you. Go for it.
Hi, yeah. So just a brief question. There's been so many changes as far as leadership positions in organizations, and some of our personal plans and career plans have changed with COVID. So some of us, and after discussing with some of the students recently, some of us are feeling like somewhat lost. So like, where do we go from here? We're going to graduate soon. Some of us are. And any advice from the from your team as far as other than the traditional job searches within our organizations and elsewhere, what are some other things that we could be doing?
Kamal, do you mean to look for opportunities in the future?
Yeah, exactly. So after our graduation, a lot of us have had for positions in organizations of COVID, those positions have actually shifted away or disappeared.
We could, from my perspective, we could spend the next hour talking about your question. If you want to, I'll offer this to you. If you want to, Amanda can give you my email address. If you want to shoot me an email, I'll be happy to follow up with you on my own thoughts and whatnot. I've done a lot of work with folks in job searches, resume writing, and et cetera, et cetera, et cetera. And I'll be happy to share information with you, just if you would find it helpful.
Can I say that's to wrap up with Don, and this is one of the really great things that I find with the Champlain program. The classes are small, and I think the professors take a real interest in the students and will really help them work through their issues. Oh, I can't turn in my paper today because I'm on the COVID shift tonight type of thing, but also that kind of job search type of issue. I'm being very immodest, but we're into it. We love our students, and
That's true.
they are the first responders. So I want my students to be good, because when I go into the hospital, I want to be in the hospital that's managed.
I would just quickly like to add to what Don and Neil just said, Kamal, that be open-minded about what role you want to have in healthcare. And I'm speaking from my own experience. Take a close look at what qualifications, what experience, what education you have to bring into an organization, and be open-minded about what opportunities you actually look at, because the opportunity you start with is not necessarily the opportunity that will become your career. So that would be my advice to you and any of the other students that are participating today that want to look for a career in healthcare. Just be open-minded about where you start. Thank you.
Yeah, I'm a great example of that. My undergraduate degree, as I mentioned, is in chemistry. I was a research assistant doing immunology research, and over through twists and turns, here I am, the director of a healthcare administration program. So you never know where your career will lead. Be open-minded. It's a great advice. And I just want to thank everybody for today, for participating today. It's been a great discussion. Let me just get that in there.
Yes. So Michael, you took the words right out of my mouth. We're right at 3:01, so I will wrap us up here. Completely echoing Michael and all of the other panelists' thoughts today. So thank you for everybody who attended. I think we had some great conversations. Don, I will be sure to connect you with our attendee who had those job questions. So thank you for offering your time there. To everybody who's on the call, also want to echo the frontline worker thank you. We know there's endless amounts of thanks we could give there. So I just want to echo that from the beginning. And for the last sort of logistic wrap up piece, this session has been recorded because we know people have to drop in and out, and we had a lot of conversations. So we'll be sure this will be distributed within the next few days or so. So please feel free to reach out further if you have any questions. But with that, thank you panelists, thank you attendees, and hope you all have a good rest of your day.
Great.
Thank you. Bye, everybody.
Thank you, Amanda.
Bye, everyone.
Bye, everyone.
You.
Thank
Thanks
you.
again.
Thank you.